I am currently working on Team B at SCF. I'm in the Fairbanks track and currently in Anchorage. So Team B, we work with individuals who are from the native villages that are outside of the Anchorage area. Oftentimes these individuals are referred into Anchorage for specialty medical problems. Sometimes they are hospitalized here for more severe issues that regional hospitals can't manage on their own. And then sometimes we have neonates who are born at ANMC and who come to us for a checkup before they go back to the village. So we are able to provide a pretty great service to these families. We do comprehensive care on Team B. So even if we have patients who are being discharged from the hospital, for example, say somebody was hospitalized for bronchiolitis and now they're being discharged, we don't just focus on the post-hospitalization issues because there's a good chance there are other comprehensive health problems that we haven't addressed. So we'll do a full well-child check, we'll do any screenings that they need, we'll provide any services that they may be missing. We do work in close contact with the regional hospitals and the village health aides, who are wonderful and who do an amazing job at reaching out to us when they need help with their pediatric patients. And we also in turn communicate back with them when we see a patient. And what we do is essentially give a list of issues that need to be addressed when the patient returns to the village and say, these are the things that we are thinking. We think that this would be a good plan going forward. Do you want to talk to us about it some more? And I've had some great conversations with people out of Bethel and Kotzebue and Barrow, who are doing an amazing job in very difficult circumstances. And I'm happy that we can provide the support that we do. So Team B is a very unique population of patients. I don't even think I fully understood how unique a population it was when I first came to Anchorage, because these aren't folks who live within a major metropolitan area and have easy access to a hospital system. And a lot of these kids that come to us are fairly medically complex. So Team B really is a team. You're not working by yourself. You are, in addition to addressing all of the issues that pop up during regular pediatric primary care, you are bringing in experts to help with additional issues. So, for instance, I've had a kiddo who was less than 12 years old with depression, and we have this BHC, this behavioral health consultant resource, that was a huge help to us, and not only talking with the kid and figuring out what was going on at home, but helping the child access resources both in their home village and, if necessary, away from their home village. We have dietitians, we have lactation specialists who are just the most amazing people. I can't tell you how many moms have walked out of Team B feeling so much more confident in their ability to breastfeed, and which is a huge, huge benefit for our kids here. The other thing about Team B is that you have these wonderful nurse case managers who are super helpful with their ability to access resources, who are probably the most patient people on earth and who do a wonderful job at caring for our kids. The partnership part of that is just huge because I could not do my job without them. So Alaska has some specialists that live here full-time and then some specialists who are here as locums, and then we also have visiting specialists from Seattle Children's or other hospitals. And we actually have really great access to specialists, which has been hugely helpful in a number of circumstances. It's saved a child from a trip to the hospital or from staying an extra day when I've been able to just call our ENT on call and say, hey, they're having this problem. Can you see them? Or do I need to be worried about this? And they can tell me what to do next or give me their thoughts on the process. The cardiologists I would call out as especially wonderful. They are so easy to get a hold of and so willing to see our patients before they go back to the village. It's rare that I can't get a patient an appointment within the week, and often on the same day with our cardiologists. And we have an endocrinologist right in clinic who has taught me a ton about the special endocrine diseases that we see in Alaska, which are not those same ones that you necessarily see in a typical lower 48 population.